and welcome to How to Gastro. In today's video, we'll be exploring a very interesting topic and one that is quite fascinating, and it's called Lyme disease. So let's get started. So what is Lyme disease? Lyme disease, which is also commonly known as Lyme Borreliosis, is an infectious disease which is caused by the Borrelia bacterium, which is transmitted to humans through the bite of infected black-legged ticks, which are most commonly known as the deer ticks. So Lyme disease is caused by four main species of bacteria. Borrelia burgdorferi and Borrelia mayoni are the most common causes for Lyme disease in the United States, while Borrelia afzelii and Borrelia garini are the leading causes of Lyme disease cases across Europe and Asia. So one is more likely to actually contract Lyme disease if they live or spend time in grassy or heavy wooded areas where the ticks which carry the Lyme disease thrive. So from this definition of Lyme disease, we get that it's also commonly known as Lyme Borreliosis. That's because the specific bacteria which is involved in this disease is the Borrelia species of bacteria. So there are four main subtypes of these Borrelia bacteria, mainly Borrelia burgdorferi, Borrelia mayoni, Borrelia afzelii, and Borrelia garini. And these four subtypes of bacterial species are responsible for causing all the Lyme disease cases worldwide. So the Lyme disease infection is actually transmitted to humans through these very important insects, which are actually called the black-legged ticks, which are also commonly known as the deer ticks. And once these ticks actually bite the human host, they can transmit the infection to the human, because through that biting process, a large amount of bacteria is actually passed into the bloodstream of the human. And this is actually how one contracts the disease. So one is actually more likely to get Lyme disease if they go on a hike, go spend some time camping, or live in very grassy or heavily wooded areas where these ticks actually tend to thrive. So now that we know what the basics of Lyme disease is, let's take a closer look at how one actually contracts this disease. So in order for the individual to contract Lyme disease, the infected deer tick must bite them. So the bacteria will then enter the skin through the bite wound and eventually make its way into the patient's bloodstream. In most cases, to transmit Lyme disease, a deer tick must be attached to the individual for at least 36 to 48 hours. So this actually allows for enough time for that bacteria to actually be transferred from the tick into the bloodstream of the individual. And if these patients find an attached tick that looks swollen, it may mean that it has fed long enough to transmit the bacteria. So removing the tick as soon as possible might actually prevent the infection from developing. So because this tick has to remain attached to the individual for at least 36 to 48 hours for this disease to actually develop, this means that the disease can actually be prevented if someone removes the tick as soon as possible before that 36 to 48 hour time has lapsed. And in this way can actually prevent themselves from developing this disease. The signs and symptoms of Lyme disease. So the signs and symptoms are actually broken down into two phases. We have the early signs and symptoms, which usually appear 3 to 30 days after the initial tick bite, and they include fever, chills, headache, fatigue, muscle and joint aches, swollen lymph nodes, and Erythema migrans rash, or an EM rash. So anywhere from 3 to 30 days after an infected tick bite, an expanding red area might appear that sometimes clears in the center, forming a bullseye pattern. And this rash, called Erythema migrans, expands slowly over the days and can actually spread to about 12 inches, which is about 30 centimeters across. So this is what that bullseye rash looks like, and this is given the name Erythema migrans, and usually develops around 3 to 30 days after the initial tick bite. So these patients will also have the fever, chills, headache, fatigue, muscle and joint pain, and swollen lymph nodes as well, in addition to this rash. So the second phase of symptoms, or the later signs and symptoms, these occur days to months after the initial tick bite and include severe headaches and neck stiffness, additional Erythema migrans rashes on other areas of the body, a facial palsy, which means the loss of muscle tone or droop on one or both sides of the face. As we can see here, this is a left side facial palsy. These patients may also have arthritis, which means the inflammation of the joint, with severe joint pain and swelling, particularly in the knees and the other large joints. They may also suffer from intermittent pain in their tendons, muscles, joints, and bones, heart palpitations or an irregular heartbeat, which is called LYME Carditis, episodes of dizziness or shortness of breath, inflammation of the brain and the spinal cord, nerve pain, and shooting pains, numbness, or tingling in the hands and the feet. So as we can see, the later signs and symptoms tend to be a lot more serious and debilitating, and this is why our aim with treatment is to start the treatment as soon as possible to prevent chronic or ongoing symptoms in these patients. So moving on, let's explore the diagnosis of Lyme disease. So the diagnosis of Lyme disease is based on the signs and symptoms of the patient, the objective physical findings such as the erythema migrans rash, the facial palsy, or the arthritis, and a history of possible exposure to infected ticks. So if the patient reports a recent camping trip or a hike in a very woody or foresty area, it will point us towards a suspicion of Lyme disease. And we will also need to do some laboratory tests. So the laboratory tests include enzyme-linked immunosorbent assays, which are called the ELISA test, and this test is used most often to detect Lyme disease, and ELISA detects antibodies to the Borreliosis bacterium. But because it can sometimes provide false positive results, it is not used as the sole basis for the diagnosis. We can also do the Western blot test. So if the ELISA test is positive, this test is usually done to confirm the diagnosis, and in this two-step approach, the Western blot detects antibodies to several proteins of the Borreliosis bacterium. So this is actually a more reliable test and can be used as the sole basis for the diagnosis. And finally, let's talk about the treatment of Lyme disease. So the attached ticks should be removed promptly as the risk of infection increases with the time of attachment. And antibiotics are the primary treatment for Lyme disease. The standard treatment for early stage Lyme disease is done with amoxicillin or cefuroxime for 14 to 21 days. And intravenous antibiotics may also be required in more severe cases where the disease involves the central nervous system. So here, the intravenous antibiotics will be given for 14 to 28 days. So much longer course because we want to make sure our body's rid of that infection. And that brings us to the end of this video on Lyme disease. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.